Hello everyone, welcome to CAFSA. Today we will learn about pre-anesthetic medication. Pre means before, anesthetic means before the anesthesia. Okay, the medicines which are used. So, before the administration of anesthetics, to make the anesthesia more pleasant and safe, some drugs are used, which controls or normalize the central or peripheral system is known as pre-anesthetic medication. Okay. To make the anesthesia more safe and pleasant, some drugs are used. Okay. Now, what are the reasons to use, or what is the aim, or you can say what is the objective of being used pre-anesthetic medication? Okay, so the aims, or it can be the objective or result we use pre-anesthetic medication. Whatever the question will be, answer is this. Okay, so the first point is we need to consider that to reduce the anxiety. Okay, the patient when goes for the surgery, obviously he or she will feel anxiety. Now, what is anxiety? Anxiety is a uneasy feeling or nervousness which increases the heart rate and make a patient tense. Okay, so to reduce the anxiety, obviously we need to use some medications that are known as anti-anxiety drugs or anxiolytics. Okay, so for this purpose, we will use some medicine which will prevent your anxiety or the patient's anxiety. Okay. Now, the second point is to reduce the vagal bradycardia. Okay, and to reduce the salivary secretion. Vagal bradycardia means the bradycardia which is produced due to the vagal nerve or vagus nerve. Okay? Bradycardia means cardia means heart rate. Brady means decrease. When the heart rate is decreased, that is bradycardia. And when the heart rate increases, that is tachycardia. And also used to reduce the salivary secretion. Okay? And this kind of effect is due to muscarinic receptors, because muscarinic receptors causes vagus nerve to stimulate and to causes decrease in the heart rate and to secretes saliva. Okay, so we need to use some medicines which can block the muscarinic effect. Third point is to relieve the patient from pre and post-operative pain. When the patient is going for surgery, obviously he or she will feel some pain before the surgery, or it can be the after the surgery. Pre means before the surgery and post means after the surgery. So to relieve the patient from pre and post-operative pain. The fourth aim should be to control the emesis or nausea or vomiting. Now, What is emesis? Emesis means the procedure of vomiting. But nausea means the feeling of vomiting, or when you feel the urge to vomit, that is nausea. Nausea is a feeling, emesis is a procedure of vomiting. Okay, so for this purpose, obviously we need to use some anti-vomiting or anti-emetic drugs, okay, which can control this situation. The point is to reduce the gastric acid secretion and prevent the ulcer which is produced due to stress. Gastric acid secretion is prevented by obviously antacids and ulcer which is produced by stress, because when a patient go for surgery, he or she will feel some stress. Due to stress, the gastric acid secretion increases. If the gastric acid secretion increases, obviously there will be ulcer. So that is called as stress ulcer. So we need to reduce the gastric acid secretion and control the ulcer which is produced by stress or stress ulcer. Okay. Now the sixth is to fast or hasten the gastric emptying before emergency surgery. Okay, because if we do not empty the gastric content, obviously there is a chance when we use some medicines, there is a chance of getting food-drug interaction. If there is any food and drug interaction occur, obviously there will be less absorption of this kind of drugs. So we need to empty the gastric contents before the surgery. So mind it, when there is a large or big surgery happen, the patient must be in fasting stage or in the gastric empty condition, prevent the food drug interaction. Okay. Now, so for this purpose, obviously we need some specific medications as a pre-anesthetic medication treatment. So we will look about the medications used. So the medicines and medication. First medicine which is used to reduce the anxiety effect as an anti-anxiety drug, benzodiazepines used, like diazepam, it can be lorazepam, or it can be midazolam, etc. Okay. Why they are preferred over other drugs? Because they have anxiety effect or decreasing the anxiety tendency with wide margin of safety, or these drugs are the safest drug. But the second, to prevent the salivation and vagal bradycardia, we use some anti-muscarinic agents. Okay, because I have previously said that these are the effect which is due to muscarinic receptors. So we need to block the muscarinic receptor. So for this purpose, atropine and glycopyrrolate are used. Among these two drugs, glycopyrrolate is the more potent drug. It is considered that more potent drug due to less tachycardia and it do not produce any central nervous system effect. Okay, so this is the more potent drug. Now, the third point is to relieve the pre or post-operative pain. Okay, so to relieve the pre or post-operative pain, some kind of opioid analgesics are used. Okay, and this kind of opioid analgesics are morphine, pethidine, phentermine. Sometimes diclofenac are used as NSAIDs. Okay, so opioid analgesics are morphine, pethidine, and fentanyl. We need to keep in mind that morphine has some limitations in case of respiratory depression, hypotension, bronchospasm, etc. Okay. Now, the fourth one is to control the vomiting. So, to control the nausea feeling or emesis or vomiting, antiemetic kind of drugs are used. Okay. And these antiemetic drugs are metoclopramide, domperidone, or it can be ondansetron. Among these, 5-HT3 or ondansetron, 5-HT3 antagonist or ondansetron is the preferred drug due to less adverse effect. Okay? Because these metoclopramide and domperidone have varieties kind of adverse effect. We will see now. Metoclopramide and domperidone, or it can be ondansetron. 5-HT3 antagonist means the drug which bind with the 5-HT3 receptor and shows the opposite effect, like antagonize the effect of serotonin, that is 5-HT3 antagonistic drugs. Okay. Now, metoclopramide, which shows some adverse drug effect like acute dystonia and extrapyramidal effects. Now we will understand about acute dystonia. Okay. So, acute dystonia is nothing, just a sudden contraction of muscles of extremities. It can be face, it can be neck, larynx, etc. due to the blockage of dopaminergic neuronal pathway. Okay. This means problem. Tonos means the tension or stretch of muscle. So, obviously, dystonia means problem in the tension or stretch of muscles. Okay. This is pre-course. Now, what is the extrapyramidal effects? Okay. So, extrapyramidal effects are produced due to impaired motor control or dysfunction of the basal ganglia. You should keep in mind pyramidal effect means when the effect is related to voluntary controls or voluntary system, that is pyramidal effect. And when it is related to involuntary system, that is extrapyramidal symptoms or effect. Okay. Now, the fifth point is to prevent the acid secretion, gastric acid secretion and stress ulcer. Okay. So, for this purpose, we will use H2 blockers like ranitidine or proton pump inhibitors or PPIs like omeprazole are used. What they cause? They actually decreases the gastric acid secretions. Okay. H2 blockers mean histamine 2 receptor is blocking by this kind of drugs. Okay. So, the fifth one is H2 blocker like ranitidine, PPIs like omeprazole are used, and it causes decrease in the gastric acid secretion. As a result, reduce in the or prevention in the stress ulcer. Okay. Now the second point is, to fast the gastric empty, we need to provide or use some prokinetic drugs. These are metoclopramide and domperidone. These are the prokinetic drugs. Now, prokinetic drugs means, what do you mean by prokinetic drugs? This kind of drugs increases the tone of lower esophageal sphincter muscle. As a result, accelerate the gastric emptying. Okay. So what they do? They increases the tone of lower esophageal sphincter muscle and accelerate the gastric emptying process. If the lower part of esophageal sphincter tone is increased, obviously there is a tendency to evacuate the gastric contents. So this is the end of my lecture. If you like my video, please do like, comment, share and subscribe. Thank you.